When I start organizing women-headed family in Indonesia, so many women, head of the family, really accept their condition as it is. So when we start organizing them, we ask them to ask questions actually. Why we are excluded in the system, why we are discriminated. The first answer is really, this is my destiny. But then we go deeper to find the root cause. And then at the end, they will see the pictures that their condition is not their destiny, but it's because of many layers that operate, that control and power over their life. So this then opened their eyes that their life actually part of the big systems which we need to change. Women-headed family in Indonesia facing multiple discriminations. So it's not only about their poverty, access to resources, but also the whole system, including from government, the law, program, policy, and then also the cultural system values which tend to discriminate and also stigmatize women without husband. Usually the system values which women live in is very difficult and challenging for women to change because they are controlled by this system value which is in herself. In PEKKA, we believe there are 3 dimensions of power that we have to deal with. First, we call it visible power. This is all related with policy, law, regulations, which control the women's life. The second, we call it hidden power. Hidden power is the role of organization, institutions, or people who have they are not in the formal structure, but they are in formal structure and influence the life. This is also including maybe corporations or business people who can influence policy making. And the third, the invisible power, which is the system values, where norm and belief and unwritten regulations with not allowed or allowed women or men to do things or not to do things. So this dimension of power need to be approached differently. So Dr. Iman Baibers, one of the women social entrepreneurs leaders from Arab regions, introduced these 3 approach toward these 3 dimensions of power. First, we need to scale deep. What does scale deep mean? Scaling deep is really to exercise the system values within in PEKKA who are considered as invisible power, right? We need to reach deep inside to challenge our own values, to challenge our own belief.
My name is Amina Evangelista Swanepoel. I am the Executive Director of Roots of Health, which is a reproductive health organization based in Puerto Princesa, Palawan in the Philippines. There are very conservative mindsets and values in the Philippines regarding sexual and reproductive health, as well as gender roles. And this has made it quite challenging, especially at the beginning when we first started our organization. Everything related to sexuality and health is seen as taboo and as very vulgar. So what happens is that, for instance, if a young person tries to ask a trusted adult, whether that's their parent or a teacher or a health worker, anything about sexuality or health, they're just shut down. And if anything is said at all about sexuality, it's to tell young people to just don't have sex. And what this does is that it doesn't provide people, especially young people, with the comprehensive information that they need in order to make informed decisions about their bodies and their health. So what we've done is basically try to gather all of the stakeholders who affect this situation. And we provide them with training and with information to try to stretch their views, try to influence them to not think so conservatively and not prolong the kind of just very negative way of looking at sexuality. We try to work very targeted depending on who the stakeholder is. And a key message that we give them is that they don't have to like or approve of the behavior that young people are engaging in. But as healthcare providers or as teachers, they are in a position to help and to change the outcomes of the lives of the young people who are trying to seek care with them. We also work with community health advocates and youth advocates who are peer resources, volunteers who come to us and who want to do something to help and want to change things either in their communities or among groups of young people. And we provide them with the training that they need on reproductive health information. We also give them tips on how to communicate, how to talk to people about sex, how to connect people to services. And they become our sustainability mechanism. They become reproductive health champions in their communities and in society, and almost working independently of Roots of Health. And so, in a way that even if Roots of Health didn't exist anymore, these community health advocates and youth advocates would still be on the ground and would still be providing people with information and connecting them to essential services.
And the second frame is really to scaling up. Scaling up basically to exercise government regulation and system. So if the policy around marriage, for example, stated that the head of the family are men, but in lived reality, millions of women become of the head of the family. So we need to change that law. Therefore, it's scaling up with this law, then we can reach out more to people.
I saw the need to expand and to scale the services of providing psychosocial support to children with cancer, and particularly child life services. Scaling up is important so that we could reach more children who are suffering from cancer. Right now, we are just limited to a very few hospitals because some medical directors are not very open still or do not understand what child life services is. But putting it in the law makes it mandatory, and it somehow pushes or encourages the medical directors to be able to open up and understand what the program is, and so that more children, especially our poor children who are suffering with cancer, will be able to benefit from psychosocial support. Because we believe in Kythe that it takes more than medicine to get well. And that is why it is important that both child life services and medical support is given to children with cancer. I am able to enact this change by collaborating with important stakeholders. I saw that I needed to engage the Department of Health. I needed to engage the medical directors in the hospitals. I needed to engage pediatric oncologists. I've been advocating for this since early 1990s, 1995 onwards. And the law was just passed in 2019. So you could see the whole time that I've been advocating and talking patiently to pediatric oncologists, to medical directors. So I kept planting seeds. Soon, someday, that will grow, that will bloom, and people will appreciate it. And true enough, in 2019, it has been institutionalized into law. We did not stop because we were very committed to our advocacy. We were very committed to really uplifting the lives of children with cancer. So even if it was not bearing fruit in the early years, we just kept on because in our minds, where we're saying that we're doing this not for ourselves, we're doing this for the kids. It's for the kids always and in all ways.
And the third is scaling out. If we want to make a change, big change, we cannot do it by ourselves. That's why we need to scale out. We need to reach out. We need to work with more people, work with other organizations or other stakeholders who have a similar concern or the same concern.
Arugaan, my organization, is like a mother to many mother support groups. We have nurtured many breastfeeding moms to become peer counselors to support women who have breastfeeding challenges and to become nurturers of the next generation. And we also mentor them on hands-on cooking, on indigenous food that heals and nourishes, and now how to prepare food, indigenous food, contra or against COVID. And in many provinces in the Philippines, we were able to establish breastfeeding support group, and now they are already on their own after many trainings, intensive trainings. And we also involve the leaders in advocacy work in the local government to help implement or what we call a law watch, milk code law watch, to monitor the insidious advertising and promotions of milk companies that undermine the power of breastfeeding. So they are involved in legislative action, policy making at the workplaces to support working women. One mother at a time, one problem at a time. So when mothers would seek information, would seek help and support that they're having breastfeeding challenges after birthing, so we come to visit them. Or if we cannot visit them because of COVID restriction, we would be on call, online, to do counseling step by step. So it's a very personalized interaction. And it's not only me and them, her, but there will also be other mothers who will be following up. So we are like a support system, a group of women who understand the issues. So it's a very caring, compassionate support for women. And we refer to doctors who are breastfeeding friendly, who are into indigenous foods, natural nurturing. So we create a network of referrals. But it is also our mission to reach out to the less privileged in the communities. If they undertake a training as peer counselor from my organization, Arugaan, and then they wanted to become a trainer to roll out the trainings in their communities, to translate it into their language, into their dialect, we help them. We help them with the training. And then they're able to also help at the local government. No matter how small, a drop becomes a rainfall. A lot of mother support group now are having their online net platform in the provinces. So we have mushroom over time. We have many mother support group now.
The system operates through power and control. That's why we need to resist in order to change the system. Based on my experiences, if we want to work on system change, first we have to question. We have to question everything we experience. And the second, we have to resist to certain values that against our willingness.